Okay, right. Yeah, I think I've got a good idea of that now. Let me silence my phone. Where's this?
You're very
Should have done
popular.
that. This is like the only time I've ever had people message me. Um, Welcome to the Course Directory, the podcast where I ask students about what they study and ask them to tell us a little bit about it. Today I've got two guests instead of the usual one, and I'm doing it in person for the first time. So would you both like to introduce yourselves?
Hi, I'm Erin.
Hi, I'm Hannah.
And what do you both study?
So we both study adult nursing at Manchester Metropolitan Uni.
Mm-hmm. Right, okay. And that is actually the university I go to as well. So both of them, we all go to Manchester Metropolitan University in Manchester. Okay, so the first question I ask people is, did you want to go to university?
Shall I go first?
Yeah, go for it.
So basically, when I was like 17, I always had that idea in mind,
Mhm.
but instead I just did other things. So I went to college for a bit, I travelled, I worked, and it was ever since like the COVID pandemic happened, that was when I did my access course into healthcare, and then that's how I got into uni. At first, I wanted to go into the military to do nursing, but then due to health complications, that didn't happen. So I chose uni, which was my second option.
Mm.
So here I am.
Right. So, and what about you?
So I also did not want to go to university. Yeah, we're both a bit older, so we clearly started late, and we're both first years as well. I just hated education, so I dropped out of sixth form and then basically like procrastinated and avoided it for as long as possible. But I was working in like hospitals and care homes, so still in healthcare. So then eventually I was like, it's kind of at the point where I have to go now. So I also did an access year, and now here we are.
Mm-hmm. All right. Well, yeah. I mean, I think it's. I mean, yeah. You both. I mean, I'm not saying this disparagingly, but like, yeah. I mean, all three of us really are older than like most people. When we did first year, I was 21 when I started first year. So like, but in a way, I feel like that's kind of almost a good thing because like, had we started when most people started, we'd have gone through all those COVID years, and it would have been really annoying, and it would have been a bad experience. I had a little bit of that when I did foundation, so. You answered a little bit of this just now, but you know I'll ask like specifically. So I mean, what was it specifically that made you both want to do nursing?
So I've just always had that idea in the back of my head ever since I was 16, but of course I was doing other things at the time, and I just didn't have much faith in myself, basically. But now that I'm more mature, well, I hope so. So I can like handle the challenge more. So you know, I mean, I'm not here to party at university. I'm here to get a degree, and basically open more doors for myself. So that's why I'm here.
Right. Okay. And I know your dad's a GP, right? So did that have anything to do with it, or?
I definitely think so. Yeah, I think growing up with a father as a GP, I've just always been curious about sort of medicine and all of the crazy stories that he's experienced and stuff. I think I've always just thought it was really cool. And then I think, it was sort of solidified in working in healthcare, sort of in the care home first, and then seeing all of the like fun things that go on, but also like being able to have that like empathy side and caring for patients and stuff, and talking to new people and meeting people from all different walks of life. I just really loved it and enjoyed it.
Mm-hmm. Right. Okay. You mentioned adult nursing, right? So that's like a specific thing. And when I was doing research for this, I looked at the MMU course page and it said there was like 5 different options for like different nursing courses. So could you like walk me through what are the like differences between those different type of nursing courses?
So you can obviously, the classic 2 is adult or pediatric, so adult or children, and they're both 3 years each. You can also do combined, but I don't think Metropolitan does it, but other unis I looked into, and then that'll be a 4-year degree to be able to go into either field. There's also a new thing called nursing associate. So a nurse is a band 4, like a senior healthcare assistant would be a band 3, and then a nurse associate is band 4, so it's sort of in the middle. And that's a 2-year degree, and then you can also do an 18-month top-up afterwards to be a full band 5 nurse. It's sort of like a newly introduced thing, I think, because there's a shortage of nursing, just to like kind of get people into the field quickly. But yeah.
And there's also mental health nursing, isn't there? But I don't know if that
I
counts,
forgot about that one.
Yeah. No, that was one of the things I saw on the course page as well. Yeah. So what is that like? Then more to the kind of, I mean, obviously you're dealing with more like clinical. Is that the right word for that? Yeah. Like.
Yes.
Yeah.
Yeah. We're much more like practical. You know, I would say with adult nursing.
There's in my class there's also mental health students as well at the moment, so they're doing a 3-year degree. So I think for first year we all do the same stuff, so the same basic clinical skills of like taking observations and injections and stuff. And it's more at the moment general of sort of what it means to be a nurse, but I think in 2nd and 3rd year we'll split off from them, and then they'll do the more like psychological side of things.
Right, okay. So now we're gonna get into like the specifics of like what you guys actually do on a week-to-week or like day-to-day basis. You just came from a class just earlier, so maybe I mean we might talk about that a bit. But so when I was looking at the course page again, it says on the core units for year 1, because both of you are in year 1, there are 5 modules. There's becoming an accountable professional, introduction to nursing inquiry and evaluation, what is health, science and skills for practice, and effective communication in health and social care. So that's a lot, obviously. So what I'll ask is, what is, out of these modules, what is one that you guys are really into?
I like the science and skills for practice.
Yeah.
It was a lot more like obviously practical based. That's when we were doing like injections and things like that.
Yeah.
I thought that was super cool.
Yeah, I think that's mine as well. Yeah.
I think, did that cover anatomy and physiology as well? Was that in that one?
Yeah, well, anatomy, so we did an A&P exam, and it was a science and skills exam, wasn't it? So yeah, I'd say that was my favourite part. A&P definitely. The others, not really.
Okay.
Like yeah. It's
So I mean, it's like a lot of anatomy and physiology, and you say like injections and stuff. So is that like, I guess, more theory oriented compared to the more practical ones?
That one was very split in two. So we had the practical sessions where you sort of have to go in like in your full uniform into uni and then do like the clinical skills and dressings and stuff, but it also had the like online learning of the anatomy and physiology, and then we kind of had the exam was sort of about anatomy and physiology or about questions on the skills, so like
yeah.
What I'm gonna ask here is like, so I have a basic knowledge of like things you should put in your body and the amounts maybe that you should be putting them in. So what, I guess like the question is like, what is it that you do on a nursing course that like, this is the stuff that's like, you really need to know, and that this is something that you as a nursing student is going to know the general public doesn't know? Like what is stuff, I guess, that like when you're doing your assessments and stuff, like they're really looking for you to know that, so that they know that like, okay, this is a person who can become a nurse one day.
I think like in first year, it's all about, it's like the easy, well it's not easy, but it's like the warm up, isn't it? And then you go into year 2, and then year 3 you're like a lot more experienced. So I don't think we'll know until like year 3 probably.
Okay, right.
So like 2nd and 3rd is more when we'll learn about like medicines and drugs and like how the body works and why it's doing what it's doing. But I think at the moment it's like the things that we're learning is like sort of the generic, what it means to be a nurse, and key like it's more like a motive, sort of those kind of skills. Does that make sense?
Okay, well, yeah, then I guess let's talk about that, right? Because I was gonna save this until later, but it just occurs to me now, and like, to be honest, I wasn't sure if I was gonna bring it up, but I saw several months ago, I saw a TikTok which was talking about most toxic uni majors, and nursing was on this list. So I was wondering, like, you know, I think sometimes it's a stereotype that nurses can have a very like, you know, stiff upper lip, or like can be a bit cold, like. So, but obviously that's not actually the case, right? Like there's a lot of nurses who are like very nice, and in fact like that's like a really important part of the job, is like being able to deal with people diplomatically. So like, what are the kind of stuff that you're learning like in regards to that?
just to like jump off that, not obviously we're not learning this, but I remember when I started nursing, one of my friends said that nursing was the degree that mean girls do. So like mean girls from school. So I agree, there's definitely that stereotype, and you do meet quite a lot of nurses that aren't very nice.
Yeah, I agree. But then like you could be lucky. I mean, I haven't had a bad experience on my placements with them. Like all staff members, I get on with them, and I also get along with the students, so I see no issue. But it depends like with who you mix with. But I mean, I guess you can argue. I mean, every job has bad colleagues.
Yeah.
Do you know what I mean? I mean, that's what I tell myself. I'm just like, well, if they're saying nursing is quite bitchy, then I mean, show me a job that isn't.
No,
you know,
yeah.
I mean, because you do get a lot of bitchiness in jobs.
Yeah, and
you just have to deal with it. It's part of life. So
we had a lecture on it actually last week about compassion fatigue, and they were saying like we often will come across like people in the workplace who aren't so nice, and I think it's because they've got compassion fatigue. So when you're so like overworked, having to like have people screaming at you and caring for them 24/7, it's like you get drained, and then somebody will like ask you a simple question, and like people just snap very easily. So I think that's probably where it comes from. Yeah,
I mean like at the end of the day, you have to tell yourself, you know, it's not you that's the problem. You know, you just, I mean, it could be like down to exhaustion, like what Hannah said, you know, what's it called, compassion fatigue? Yeah.
Or burnout is the other one.
Burnout, yeah, and like, I mean, because a lot of them are, but then, you know, I don't think that's their fault. I think it's just been run badly.
Yeah.
NHS, I think it's the government's fault.
Yeah.
Really.
We'll definitely get into that as well later when I ask you about placement experiences. But yeah, I mean, okay, so I guess like ask specifics about like this stuff, right? Like it says becoming an accountable professional. So like I have a general idea of what that means. Like just, you know, in any professional capacity, you have to be, you know, professional to some degree, or accountable. Like, but what does that, like, what are they teaching you specifically in nursing about like accountability skills, I guess?
So it's uniform policy, isn't it? Like what we have to wear. You know, like we can't wear jewellery. We have to wear the correct footwear, and then just like follow health and safety regulations. Yeah, there's a lot to it.
Yeah, that assignment, the module was sort of a lot about professionality and stuff and appropriate relationships with patients and things like that, but the assignment was on uniform policy and below the elbow policy, sort of hand washing, that kind of thing.
Yeah.
Right, okay, that's interesting, I guess. So like, yeah, I mean, again, like, not to go off of stereotypes too much, but I mean, this isn't even a real stereotype, but you know, like, you've both probably heard of Florence Nightingale syndrome. So like, yeah, so it's things like that, right? Like to do with having, and maybe this relates to what we were saying earlier about like some people have the perception of nurses as being a bit detached, but really that, you know, in a sense that's kind of necessary to some degree. Like if you're too personal, like, you know, if you're not impersonal, that's actually maybe a bad thing sometimes, right? Yeah. Okay, so it says what is health? That's a really general thing as well.
That was general. That was our most recent one. We basically, obviously the question kind of can't be answered, and that was the whole point of it. There's a lot of different, I think the World Health Organization does a really good definition. It's very like personal, but the assignment was basically just like making a poster about like a specific region, sort of comparing two regions, talking about how health is more than just like the physical symptoms. It's like a lot about background, where you come from, what environment you're in, and that all contributes to somebody's health. So we're sort of looking at richer and poorer places across the UK, and then comparing like the health data from there. It's quite interesting.
Yeah, it was an academic poster. I mean, I didn't really enjoy it. Did you? I mean, no. But yeah, basically what Hannah said, that's what it was.
Yeah, no, that sounds, I guess, yeah, like, I mean, maybe this is a lot to do with the fact that you're in first year, but, like, I guess, like, a lot of courses like that, I would think, like, because what you just said just now, like, comparing health outcomes in society, like, to me that, you know, it almost sounds, like, parallel to, like, what people do in criminology, right? Like, people in criminology, I guess you would think, like, oh, they're the guys who just want to lock everyone up, but, like, a lot of criminology is also to do with, like, you know, specific ways that like certain populations are more vulnerable to like falling into crime and things like that. So I guess like yeah, in the first year you deal with a lot of like I guess maybe big picture stuff to do with nursing, like what like instead of talking about like okay, how am I gonna be a nurse? It's like well, what does nursing mean like in the context of society or the NHS or
Definitely would agree with that. Yeah. It's
Yeah.
about the broader, more holistic picture at the moment.
okay, right. Yeah, so as I was looking at the course page as well, it said I forget what the exact thing is, but it says like the breakdown of like learning is 40% lectures and seminars and 50% placements. So a lot of your course is placements. I'm also aware of that. It seems like your last placement was really, really busy. So what is it like being on a placement? Because I feel like that's really different from like a lot of, especially for me, like I've never had any kind of work experience or that kind of thing. Yeah, what is a placement like?
I enjoy it. It's obviously not for everyone. It can be quite stressful. But basically it is quite intense because you're there for like 12 hours and we have to complete 37.5 hours a week and it does get quite draining at times, and we also have to do night shifts, but that's like we don't have to do it in first year, but we have to do at least 700 hours in second and third year of night shifts, and in total we need 2,300 hours by the end of year 3, isn't it? 2,300 hours. Yeah. But it's a lot to learn. But in a good way. I think I prefer being in placement than sitting in a lecture not doing anything, because I'm that type of person. I'm physical, so I just like to be on my feet, helping people. Just being busy really. It's how I learn.
Same for me. I love placements. You sort of do. I think the shortest placement you'll do is 4 weeks, and then the longest in year 3 or 2 is 12 weeks. So they're kind of varied. Our last one was 8 weeks. It's sort of all different lengths.
I mean, I feel like this is maybe the best place to ask it, but like I was thinking about like liability, right? Because like a lot of like when you're in a hospital, like there's a lot of concerns about liability and stuff like that. So I mean, as a student, obviously you're not like fully, I don't know, like you don't have the same like
we're not
level as other
qualified.
people, and so like if you're having to do certain things, like what is it like liability wise? Like what does that mean for you?
So I guess like the main point is like we should most of the time be being supervised by somebody, by a registered nurse. We work like we learn a lot of our basic skills by like following healthcare assistants and things like that, and then we can sort of go off and do our own thing when we're doing like basic personal care, like washing people, hygiene, helping people to the toilet and things. But if we're like giving medications or something, it will always be supervised by a nurse.
Yeah, we can't do it on our own, the meds, because obviously they're important. So everything else, like basically, the stuff the healthcare workers do, the healthcare assistants, we're allowed to do. But with the stuff the nurses do, we always have to have someone with us.
You'll sort of get like when you start a placement and like they don't know you yet, they'll have to like probably watch what you're doing for the first week. So if you're checking blood sugars or something, you'll need to be supervised first. And then when they like trust you and they can see you're competent in that, they'll just leave you to do it on your own for the future.
Right. Okay. That pretty much answered like what I was thinking, I guess. Yeah. So yeah. What like specific placements do you do? Because my sister's a doctor, so she had like different when she was doing her. I don't know what you call it here, but like when you've graduated medical school, but then like you're just starting out, you do like an internship or a housemanship or whatever, and you do like different wards and you have to kind of rotate around. So like I'm guessing you guys do that as well. So what are the different kind of wards that you go on, and what are the different things you do on those?
So I've had 2 placements so far. I'm about to head into my 3rd. My first placement was like renal dialysis. The ward was called acute kidney unit, and that was only for 4 weeks, so that was quite interesting. And my second placement was called the elective treatment centre. So it was basically a head and neck surgery a short stay ward where like patients would go down to theatre to have like, you know, like put a like for surgery for the, you know, something, anything in their head and neck, so like a laryngectomy, they need a laryngectomy, they get surgery for that. And then once they're recovering, they stay in the ETC ward. And yeah, that was quite interesting. I mean, it was a massive ward though. And we have done spokes as well, so it means like we can get like transferred to other wards. And so like for example, I got transferred to a theatre ward where I watched and had a head and neck surgery being performed. And but yeah, it's just always best to like, you know, like grab as many spokes as you can really, because it just makes it more interesting. I mean, when you're in the same ward every day for 4, 5, 6, 7, 8 weeks, it's quite draining. You just want to try something different.
Nice. My first one was also sort of renal, so I was urology and nephrology. So it was like a 24-hour care ward, so we did the 13-hour shifts, and it was quite interesting. It was like patients sort of, with kidney problems, so a lot of like patients with like neph bags or like drug addict patients, and a lot of older people or like younger people in like rugby injuries and stuff like that. That was really good. And then the most recent one I did, it was a day surgery ward, so I was mainly sort of like admitting people into the hospital and like taking their details and stuff like that, and then like discharging them afterwards and the post-surgery care and stuff that goes along with that. And that was just 10-hour shifts, so just 4 a week. But that was good. We also did so spoke is when you like go to another ward to like visit them for like a day or a couple of days or something. So I got to do spokes in like endoscopy, which is when they have the tubes that go in all different holes in your body, and that was quite fun to watch. That sounded really gruesome, sorry.
Yeah.
Just a bit. Okay, no, I mean, I don't know if this is going to go in, but I did want to, now that you say it, when you put it that way, like, endoscopy, so like that's those little things, isn't that those like little things they do to film inside you? Is that not what that is?
Yeah.
Right,
yeah.
so it's that then.
Mm-hmm.
Yeah,
Right.
yeah. With like a camera, and like patients like often need to get sedated for it and stuff, and then we like see some tumours and stuff, some quite sad things, but also got to spoke into a urology ward, and into surgeries as well, into theatres. That was very cool to watch that.
Right. Oh, you mentioned sad things just now, so that's like a little bit of opportunity for me to transition into this. Like, so my sister will often like tell me stories when she comes back from work. Like, she does I forget the exact word for this now. Oh yeah, she's in the emergency department. She works in the emergency department, so she's like doing triage most of the time, and which is when you're like deciding like how serious people are, right? So like sometimes she'll come back and tell me and my other sister like a lot of like really gruesome stories, and like they can be very depressing sometimes. So like I'll ask you like some more light-hearted questions to do with like the mental health toll of doing nursing after this. But like what like, I mean, you said you worked in a hospital before, right? I mean, so maybe you like had like some experience with that, but did you have that, or?
Yeah, so I did work as a community care assistant when I was like 18, 19. And I've got some experience, yeah.
Right, so then how is that like mentally dealing with like having to kind of see people at like really miserable moments essentially like all the time?
Like when they get diagnosis
Or like people with serious injuries, or
I think, I mean, like obviously for some nurses it can be quite, I mean it is a mentally challenging job. That's why nursing is so tough, and also it's long hours as well. I mean, but I think you just find a way to cope with it. I mean, it is mentally challenging,
It can be really hard, I think you see a lot of like sad stuff, especially in like previous experience. I think like talking to people is massive, so like whenever I come home from a shift I'll just like vent everything to my housemates and just like get it all out. A lot of stuff you do become desensitized to, unfortunately, which kind of helps, but there is definitely tricky stuff. The most recent lecture was sort of telling us like how to deal with that and like how important self-care is and stuff, and journaling and processing, and acknowledging that it is a hard job.
Okay. All right. On a more lighter note, like obviously students in general are like really renowned for being really bad with like timekeeping or like waking up early to go to class. Like I've missed a lot of early morning classes, but then that's not really like, especially on placement, that's not really an option for people, you know, who are doing those kind of courses. So like how do you find that then, like?
I mean, you get into a routine. So like, I never used to be really good in the early mornings, but now I've adapted to it, and but it does get quite tiring at times because you get up at 6 and then you have to be there at like 7, half 7, and then you finish at like 8 o'clock, and then you basically just go home, make yourself some tea, and then go to bed. And but you just get into the routine of it, and they're very strict with timekeeping as well, aren't they? So you can't be late really, because you could basically fail the course if you're late. So yeah, they're very strict.
I'm also really just not a morning person. I think I've been quite lucky because our like course is split into 2 groups. I think your group has all the 9 a.m.s and ours have all the 1 p.m. starts for lectures. Because we like never come in the morning, so I think it must be you guys that have to. So I've been fine with that department.
Yeah, because maybe that's why then. Because so we get morning lectures. So yeah, you must find it tougher then for placement.
We
early in the morning.
Placement is always a shock.
Yeah.
But I think because you have
hospital,
to.
So,
you can't just force yourself.
Yeah, I mean, like in the when I was working out in the community, it was we actually did like longer days than that. So, I mean, okay, it was a few years ago now, but yeah, it's just something you like. It gets drilled into you. So and it's good practice for the future, like when we become qualified. So but yeah, just have to suck it up.
Yeah, that's a good way of putting it then, I guess. So then, I mean, from that, like, it seems like that prior experience was really helpful then in terms of like getting used to the more disciplined aspects of like the course.
I definitely think it's helped so much. I think I would have really struggled with the course if I hadn't done anything before. I think it would have been such a shock, like seeing that, having those like basic skills of work ethic and clinical skills as well has really helped.
Yeah, I think when I was only like 18, so I was very young, but when I was working in care, I did find it quite, upsetting. I'd come back and I'd deal with the dying patient, and I'd come back and then I'd have a bit of a cry about it. But now, I think I've got more of a backbone now, so I just deal with it better.
Right. Yeah. One other thing I wanted to ask about is that we're in the UK, and so I mean it's a global thing, really, a global strike wave. But then in the UK especially recently, there's been a lot of strikes. Even nurses unions like the RCN, the RCN doesn't traditionally go on strike much, but then even they've gone and voted for strikes recently. So, and I think your last placements, both of you were during the really big strike. So how did that have any impact at all on the experience?
Well, I know that there were some placements. It did affect a few students on our course, because there were some wards that did go out on strike. So the student had to either stay home or go onto a spoke somewhere else. But it didn't impact on me, luckily.
For the nursing strikes, I think that was in our first placement. I just didn't go in for those days and then just worked other days, so that was fine. But yeah, the junior doctor strikes on my most recent placement because of the day surgery ward. They stopped all of the pre-planned surgeries, so then there was just nobody on the ward, and we were all just kind of sat there is somebody going to come and tell us what to do? And eventually they just moved us about, so I just went to a research ward for a couple of days instead, but it was good, yeah.
Right. Okay. So they're not really. I mean, I don't know. Based on what you're saying, it doesn't seem like it's had that much of an impact, really, then on learning specifically.
No. But the university, they do warn you about this stuff. They email you, don't they? They email constantly. If your placement is on strike, do not go in. Go in another day, and so they know about it.
Yeah, I think the PEFs what's the PEF stand for? practice education facilitator, I think.
I think you're right, yeah.
In each
I didn't know,
hospital.
but just I would say path.
Yeah.
But
in each hospital they have somebody who's like in charge of all of the students and like you know where their office is and you can like go to them for support, and then when the strikes were there they were pretty quick to come out and like replace everybody, so yeah, it didn't have an impact on learning.
Okay, right.
Hey, just a quick interlude here, just to say, because we didn't say this during the podcast, that full solidarity to the nursing unions and junior doctors unions that are all striking for better working conditions. I think I can speak for Hannah and Erin as well in saying this, considering that they've been on a magazine cover actually saying student nurses support the strike. So yeah, just short quick interlude to say full solidarity to those people striking for better working conditions.
So, I mean, before we get to the end and the final question, I've got maybe 2 miscellaneous questions that I had prepared for this. So the first one is, if I was to have a serious medical emergency right now,
Oh no.
how confident are both of you that you'd be able to help me?
I would say give me an example.
Well,
of what
let's
would
say
be.
let's say you weren't sure and I just fainted.
You just fainted.
Yeah.
Fainting's fine. I've had a few friends that have
Mhm.
fainted and I feel pretty confident dealing with that.
Do you know what? I haven't dealt with anyone that's fainted. Yeah, I think I would just turn to Hannah.
To be
like,
fair,
what do you know?
no, when my friend fainted, I did just slap her.
Yeah, I would shake you.
And that worked.
I would shake you. I'll shake
Right,
you by the
like a
shoulders.
broken TV. Yeah.
And then if no response, I'd probably throw some water on your face. And then if nothing, I'd feel your pulse. And then if nothing, then I'd phone the ambulance.
Yeah, phone ambulance.
Right.
straight
Okay.
away.
So
I would do CPR, but
I feel like we could get you in like recovery position, make sure you're alright until an
Recovery,
ambulance came.
Okay,
yeah. Oh
right.
yeah.
Yeah.
right. So I mean, I think it should go without saying that I would be in better hands than if it was just 2 random people who.
Yeah.
I would
Okay,
say
yeah.
Because I
Okay.
think just a random person, they would be like, oh shit, they wouldn't know what to do, and then
Mhm.
they'd phone the ambulance immediately.
Right. Okay. Right. Okay. The other miscellaneous question I had was, your nurses, and then in terms of hospital staff, people think of nurses and doctors, right? So that it's like so maybe this is like for people who are listening only on the audio, a dog tried to attack me just now. It was very dramatic.
It's a near death experience. Luckily, you
Yeah.
have 2 nurses.
So yeah, is there beef between doctors and nurses?
100%.
Yes.
Absolutely.
Yeah. Oh, definitely. I think the doctors stress the nurses out.
Yep.
Yeah. I mean, we understand that doctors are busy, with their own lives, but yeah, I think us nurses deal with the rubbish you get from patients, definitely. Wouldn't you agree with that?
Absolutely. I think there's a massive hierarchy in nursing,
Yeah.
so obviously doctors are at the top of that, which is very frustrating because from
Yeah.
our point of view, they don't deal with the patients as much, they don't
No.
understand enough about them as people, they just are they need to do this, this and this, and then
Yeah, and then they might approach a patient and be like, right, so and so, you need to take this twice a day. All right, yeah, see you later. That's basically what they do, and then they're left alone with the nurse. And then anything they're angry about, they flip out at the nurse, don't they?
It's true.
And it's like, yeah, that's what me and Hannah are doing right now.
Right.
It's still
Okay.
Pray for
whatever,
us.
we love them really.
Yeah.
Okay. Well, you say you love them. I'm gonna go a bit further into the drama here now.
I respect doctors, I do, I respect them. I mean, I respect nurses as well. Yeah.
Yeah. Okay, so I've watched a couple of episodes of the early seasons of Scrubs, and one of the plot.
Okay.
Sorry, yeah, going off of just totally random nothingness, but it's a plot point in some of the earlier episodes that sometimes nurses know more than doctors who are fresh out of school. So would you say that that's the case sometimes? Do you feel?
Absolutely.
Yeah.
It's I've
Yeah.
seen on wards a new junior doctor trying to override a nurse that's been on that specific ward for 25 years and they just go off on them. It's quite funny. But I think they are obviously very skilled and they know a lot about what they're doing, but I think there's some room for them to step back and listen sometimes. Do you agree?
Yeah, I mean, like, I feel like with an experienced nurse, I mean, you can't compare really. I mean, if it's a doctor fresh out of school, you know, I mean, the nurses have more experience dealing with, you know, patient care, with the medicines, and I don't think the freshly new doctor hasn't, you know, they're still brand new, so yeah, sit down.
Sit down.
The sister who usually watches this is a doctor, so that's great. I think she would probably agree with some of that anyway, but yeah. Okay, so the final thing that I ask people on this is, should everyone study nursing, or do you think, like, you know, the stuff that you learn on your course, is it stuff that the general public, like, it would actually be beneficial to society for everyone to learn that?
Good question. I think not everyone should study nursing. I think some nurses I've met should not study nursing.
Yeah.
But I do think that there's like space. There should be space in schools to learn like basic skills. So like basic wound care, what to do in like emergency situations, CPR and stuff. I think that should just be like taught across everybody.
Yeah. I mean, like, I don't think. Yeah, I agree with Hannah actually on that one. Yeah, because I don't think nursing's not for everyone. I mean, you know, yeah, I mean that there are quite a few nurses out there that shouldn't be in the profession. You know, they're just unprofessional. They don't know what they're doing, etc. And it's just just makes it turn into like a massive war zone.
Sorry, war zone?
War zone, yeah. Just I mean, yeah, just stressful.
Okay, right.
Yeah.
Okay, yeah. That's it for my questions. I can throw these notes away now. Typically, I will say, like, thanks to both of you for coming on. I forgot to do that for the last person that guest started. I forgot to thank them for coming on. But yeah, thanks both of you for being on. This has been the 4th episode of the Course Directory. I ask people usually if they want to have like any final thoughts or final things that they say, and then
I'm really enjoying the course, is my overall thoughts. I think that a lot more people should do nursing. It's very fun.
Yeah, I agree as well. Yeah.
Right.
I mean, I don't recommend it to everyone, but yeah, if you're into healthcare, I do recommend it.
That is it for this week's episode of the Course Directory. I'll be back next week to talk to someone else. Thanks everyone for listening.